Hello everyone, thanks for clicking on my video. Today our topic is epinephrine. Epinephrine is an adrenergic drug or sympathogenic drug. It is a catecholamine. It is one of the most important drugs. Epinephrine has both alpha and beta effects. That means epinephrine stimulates both alpha and beta receptors. Here the structure of the epinephrine. Here we have amine nitrogen. Amine nitrogen, the more substituents on the amine nitrogen and the more potent stimulator of beta receptor it is. Here we have one substituent methyl on the amine nitrogen, so epinephrine is not potent stimulator of beta receptor. Methylated norepinephrine is epinephrine. So by this we can say that norepinephrine plus methyl gives rise to epinephrine. Most of the epinephrine is released from the adrenal medulla. Adrenal medulla releases 80% of epinephrine and 20% of norepinephrine. Low doses of epinephrine causes vasodilation, that means beta effect, which is inhibitory. High doses of epinephrine causes vasoconstriction, which is alpha effect, which is stimulatory. Beta 1 receptors are mainly present or primarily located in the heart. Beta 1 receptors are exception because most of the beta receptors are inhibitory except beta 1 receptor, which is stimulatory to the heart. Using of epinephrine causes stimulation of beta 1 receptors causes the positive inotropic action, which increases the contraction rate, so it increases the cardiac output. So this is mainly used in the cardiac arrest. Epinephrine is mainly used in the cardiac arrest. Epinephrine causes increase in the secretion of renin. Renin is a potent vasoconstrictor. Epinephrine has both alpha and beta effect. That means it constricts and both dilates. It constricts the skin and mucous membranes because skin and mucous membranes does not play a crucial role in the flight or fight situation. But liver and skeletal muscle play very crucial situation like gluconeogenesis, glucogenolysis are very crucial for the flight or fight situation. Obviously skeletal muscle is very important in the flight or fight situation. The both combined effects of constriction and dilation causes the renal decrease in the renal blood flow. Generally in the lung, beta 2 receptors are present. Beta receptors are inhibitory, so epinephrine inhibits the beta 2 receptor, causes stimulation of beta 2 receptors, causes the bronchodilation. And mast cell inhibition. Mast cell inhibition because if the mast cell are stimulated, then it releases the chemical mediators, histamine and other inflammatory chemical mediators, which causes inflammatory response. Epinephrine increases the glucogenolysis because we need more glucose in flight and flight situation. It increases the glucose, so increasing the glucose level in the blood, it decreases the insulin, because if the insulin secretions are increased, then the glucose goes into the tissues. We do not need this in this situation. We want more glucose in the blood now. Lipolysis, because in the lysis of lipocytes, release of fatty acids, which goes through the process of gluconeogenesis and produces the glucose. Epinephrine is used in the anaphylactic shock type 1 hypersensitivity. Epinephrine is used in the local anesthesia in the low concentration because epinephrine causes the vasoconstriction in the site of injection of local anesthesia, so that local anesthesia cannot spread to the other body parts or areas. Obviously sympathogenic drugs cause the mydriasis, so epinephrine causes the mydriasis. It is used in the intraocular surgery. Pharmacokinetics of the epinephrine. It is preferred in the intramuscular or intravenously. It is short action because it is destroyed rapidly by the MAO and CONT. MAO are monoamine oxidase, and catechol-O-methyltransferase. All catecholamines are rapidly destroyed by the MAO and COMT. Endotracheal tube by inhalation. If the patient wants the bronchodilation, we can give the epinephrine by endotracheal tube by inhalation, so that the epinephrine goes directly into the lungs. Adverse effects of the epinephrine are anxiety, fear, tension, and headache. Insulin, we already discussed that insulin secretion is decreased. So the patients with the diabetes should take more insulin to balance the insulin secretions. Overstimulation causes the tachycardia. Overstimulation of beta receptors by the epinephrine causes the tachycardia. Generally, in the hyperthyroidism patient, the thyrotoxicosis occur. In the thyrotoxicosis, the patient's receptors are more sensitive to the epinephrine. So even if the small doses of epinephrine is given, the patient will have more action of epinephrine. Use of beta blockers which are non-selective to prevent the vasodilatory effect. So if you use the beta blockers, the vasodilatory effect is prevented, so that it does not affect the action of a vasoconstrictory effect of alpha receptors. So if it does not affect the alpha receptors action, so there is increase in the total peripheral resistance. If you like this video, please like, share and subscribe. Thanks for watching my video.